Hey guys, welcome back to UWorld Next Gen NCLEX Review. My name is Nicole, here with another question drill set. Welcome in. If you are new here or if you're just randomly clicking on and don't know what's going on, we do these question drill sets every Wednesday and Thursday to help you get prepared for the NCLEX and start getting into a good practice of how to answer these NCLEX questions. So today's topic is most missed questions. A lot of you guys love these most missed questions. It's a compilation of pharmacology, cardiac, critical care, OB, just a whole range of things that are mostly missed because they're pretty tricky. You got to pay attention to keywords. So let's get into good practice of how to answer these questions better. Let's see, we have Samantha here in the chat. If I go a little bit too fast and you need reiteration on something, she will be in the chat to help answer any questions you may have. And I just like to ask lots of random questions that you can also answer in the chat, and I can pull it up on my chat here and give you a shout out or read your answers. So don't be shy to talk in the chat room. So without further ado, let's get started. First one, EKG. A lot of people have problems with the EKG, so I will help you guys through this. The nurse is caring for a client who is short of breath and experiencing the cardiac rhythm in the ECG strip shown below. Which of the following actions should the nurse take? So I want to also give you a hint for this one. In our case, this is a 10-second strip. So think about that when you're calculating anything that you might have to calculate. So 10-second strip. Are we going to what? Option 1, administer an IV fluid bolus. Option 2, prepare the client for synchronized cardioversion. Option 3, instruct the client to bear down. And option 4, prepare to administer IV push atropine. Which one do you think that we should do first? Let me know. Again, this is a 10-second strip, so calculate appropriately. And if you're just tuning in or you are new here, make sure to share, follow, tell your classmates, your friends, everyone about UWorld, and give them the keys so they can know how to answer these questions correctly. Let's create a big old community. We reached 50,000. We would love to reach 75,000. So yes, just share to everyone. We would love to be friends with everyone. I see Miss Keisha Keys. I almost called you Alicia Keys. Miss Keisha Keys on TikTok just passed her boards today. Congratulations to you. That's so awesome. Welcome to the nursing world. Who else? Anyone else recently passed their NCLEX? Let me know. And I'll give you guys a shout out. Okay, while y'all are putting that in here, I will move to the answer choice, which is option 4, prepare to administer IV atropine. So let's break this down. Again, like I said, this is a 10-second strip, so we got to figure out what this strip is even reading. What is this heart rhythm? So first thing that I like to do to figure out what the rhythm is I go a little I guess, cheat sheet is there a P wave? And I do see P waves. Are there QRS waves? There are QRS waves. Are the P waves with the QRS waves? There seems to be one for each. For each P wave, there is a QRS. And then is everything equal? I know you guys can't zoom in, but it is equal in this strip. So then you start counting each QRS wave to try to get the rate of what the rhythm is. Since this is a 10-second strip, I counted 9. So 9 times 10, am I doing that right? Yeah. Or 9 times 6, because 10 seconds and there's 10 or 6 10 seconds and 60 seconds. So multiply 9 by 6, you get 54. So the rate of this strip would be 54. And we know 54, anything less than 60 is considered bradycardic. So we are trying to, in summary, we're trying to figure out what would be the best actions to take for a sinus bradycardic rhythm, which would be option 4, administer atropine. Atropine is a medication that we give. It kind of speeds up the heart rate and it accelerates the SA node to put out more electrical current beats so you can get back to your normal rhythm between 60 and 100. So atropine is the medication of choice. I always think of the T in atropine as adding, so we're adding more beats in that medication. Options 1, 2, and 3, these are all interventions that we would do for a tachycardic rhythm. So that would be actually the exact opposite. We would give IV fluid bolus if the client's heart rate was very high, like above 100. We would plan for a synchronized cardioversion, and we would instruct the client to bear down for all tachycardic rhythms. But we would actually also do that in the least to most invasive with that. So we would instruct them to bear down, then probably give them a fluid bolus, then synchronized cardioversion if it was a tachycardic rhythm. Always go from least to most invasive, and keep that in mind with questions coming up. But you guys did great on that one. Let's move to the next question. The nurse is caring for a client with syndrome of inappropriate antidiuretic hormone. Which of the following actions should the nurse take? Select all that apply. Option 1, administer vasopressin. Option 2, implement seizure precautions. Option 3, perform frequent neurological checks. Option 4, keep a strict record of fluid intake and output. And option 5, maintain IV infusion of 0.9 sodium chloride. Let me know what you guys think in the chat. We have Nurse Chris. She passed February 8 on TikTok. Congratulations, Nurse Chris. Good job. Let me scroll up and see if anyone else recently passed. I think a lot of people are still asking why multiply by 6. We were multiplying by 6 on that last question because it was a 10-second strip. So 10 seconds, in a 60-second time frame, there's 6 of those 10-second strips, so you multiply by 6. So that's why. I hope I didn't confuse you even more. 10 seconds times 6. Good job. Who else has passed? I got a lot of correct answers. Some people are missing an answer or two on this one, but a lot of correct answers. So we'll just go ahead and move on to this correct answers. Options 2, 3, and 4. For a client with syndrome of inappropriate antidiuretic hormone. So, syndrome of inappropriate antidiuretic hormone. What is that? That is when someone, let's break it down. Antidiuretic hormone. That is when you hold on to your fluid, hold on to your water, because your kidneys need that fluid for whatever reason. Maybe we need that fluid in our circulation to keep our blood pressure up, to keep our heart rate up, or maybe we need to reperfuse the kidneys for whatever reason. But this hormone is secreted by the pituitary gland to hold on to our fluid. So if we're having a syndrome of inappropriate antidiuretic hormone, this means that we are releasing this hormone at an incorrect time, or we're releasing this hormone too much, or there's too much of it. So we're holding on to too much fluid. So what are we going to do? When you hold on to too much fluid, there's some side effects that happen. Your weight goes up, you start getting really swollen all around because you're holding onto all this fluid. Since you are holding onto this fluid, that also kind of dilutes some of your electrolytes. The key one here being your sodium, because wherever water goes, salt follows also. So, or salt, wherever salt goes, water follows also. So you're diluting all that sodium. So with a hyponatremic, because it's diluted, with a hyponatremic state, you're going to have a lot of neurological problems. So this is why you implement seizure precautions and you do the frequent neurological checks, because the brain is very sensitive to sodium. So if it has a little bit of sodium and it's being diluted out, the brain starts freaking out. Option 4, keep a strict record of fluid intake and output. Of course, we want to do this if we're holding on to, or if we're having a problem with holding on to too much fluid, then we need to know exactly how much goes in and how much goes out so we don't create further problems down the road. The reason why option 5 is incorrect, maintaining an IV infusion of 0.9 sodium chloride. we don't need to add any extra fluid into our system if we're already having a fluid retention problem. So that would just exacerbate and make the problem even worse. Option 1, and administer vasopressin. Sorry. This would be incorrect because vasopressin also kind of helps keep that fluid inside. It's a synthetic version of ADH, so we don't need any more extra ADH in our system. So if we're giving vasopressin, we're just, again, going to exacerbate the problem and make things worse. So options 2, 3, and 4, those are our correct answers because those are sodium problems, monitoring issue or monitoring intervention. So those are the good answers that we need. But you guys did great on that one. Let's see. The nurse is reviewing new prescriptions for a client who is scheduled for induction of labor. The client has a history of previous cesarean birth and a positive test result for Group B streptococcus, GBS. Which of the following prescriptions should the nurse clarify? Option 1, oxytocin. Option 2, ampicillin. Option 3, misoprostol, and option 4, nalbuphine hydrochloride. You can tell that I am not an OB nurse because these words are a lot harder for me. Let me know what you guys think in the chat. What your answer choice would this be? Clarify. Keyword here is clarify. So think carefully. There's a reason why this question is missed most, and I will clarify that for you at the end. If you're just joining in, we're practicing most missed questions, and we go live every Tuesday, Wednesday, and Thursday with these live lecture and NCLEX review. On Tuesdays, we do lectures, so Samantha goes in and does a full topic lecture, mini lecture at noon on Tuesdays. And then on Wednesdays and Thursdays, we have question drills 2 times a day now. On Wednesdays, we go live 2 o'clock and 3 o'clock Central Time with question drills. And then on Thursdays, we go live 11 a.m. and 3 p.m. Central Time. So we have lots of times for you guys to tune in, get this extra free resource to help you review and get ready for the NCLEX. Practice, 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 because practice makes progress. And that's what we need right now. So let me know what you guys think of this answer choice. Clarify, clarify, clarify. And I will let you know, we have a good mix of answers for this. We have 1s, 2s, and 3s. The correct answer for this one is option 3, misoprostol. So let's break this down. Clarify means what is not safe. What are we going to try to stop before it reaches the client so we can prevent something bad from happening? So what is misoprostol? Is a cervical ripening agent that is used before the onset of labor. These medications soften the cervix so it's more pliable, and so it can allow dilation and then effacement so the child can come through. But due to the factor, misoprostol is contraindicated in clients with previous cesarean birth. So because this can increase your risk of uterine rupture. It's a very sensitive medication. It also helps evacuate the child and the fetus very quickly, which is used also sometimes for clients that are having a miscarriage. So if a client that had a previous cesarean birth, we wouldn't want to instill, it's given vaginally, we don't want to instill this to that client because we want to go back and probably do another cesarean section to try to give it the most stable labor and everything. So misoprostol would be the medication that we want to clarify because we don't want to give it to a client that with a previous cesarean birth. Options 1, 2, and 4 are all correct options. These are all safe for a client who is in labor or probably scheduled for an induction. Oxytocin is used to induce the labor. Ampicillin is antibiotic to help that is given for the strep B to help prevent it transmitting to the child. And nalbuphine is a medication that is given to help with the lungs. So it is appropriate, or not lungs, sorry, to manage pain. So it's also okay to be given, especially during labor. So good job, guys. Question 4. The nurse is caring for a hemodynamically stable client who is experiencing cardiac rhythm in the ECG strip shown below. Which of the following actions should the nurse take? So again, break it down. Read this ECG, figure out what rhythm it is reading, and then I gave you a hint earlier about how you should factor these answer choices. Option 1, prepare to administer amiodarone. Option 2, prepare the client for immediate defibrillation. Option 3, continue to monitor the client. And option 4, request a prescription for digoxin. Which one do you guys think would be the answer choice? How should I treat a client with this ECG? Looks kind of scary. Should I be scared? Should they be scared? Let me know what you guys think. Also, let me know, now that we're about halfway in and we have a good amount of people in the chat, good amount of people watching on both TikTok, Instagram, and YouTube, let me know where you guys are tuning in from. I like to see if we're mostly in the United States, if we're in international countries. Let me see. Let me know where you guys are tuning in from. We have lots of good TID points in the chat as well. Stable and has a pulse, so that is another hint for a good answer choice. We have Kentucky, Ohio, Michigan, North Carolina, Toronto, Nairobi, Kenya, Ghana, and Canada. Lots of Canada today. Love you, Canada. Colombia, Las Vegas, Miami, Edinburgh, I don't know where Edinburgh is. Australia and Argentina. Where is Edinburgh? Can you tell me more where Edinburgh is? Nigeria, Ghana, Canada, Nigeria, DC, Ohio. People from all, I feel like it's a good mix of United States and international. Because we have El Salvador, we have a lot of people from Canada today. Hello, Canada. I can't imagine how cold it is. I'm complaining that it's cold because Texas is what, in the 30s, 40s right now, which is freezing for us here. But Canada, I'm sure you're like, oh, that's nothing. You would love that. Okay, I always get distracted. Correct answer for this one is option 1, prepare to administer amiodarone. Okay, so again, let's break this down. ECG strip, let's figure out, do we see P waves? Not really. QRS waves. That could be the QRS wave. It's looking real ugly, so we know that this is a ventricular problem, and the leading name in this rhythm would be a ventricular type of name. So, and there's a lot of them. Again, a 10-second strip. I didn't even count it. I just know it's going very, very fast. So this would be considered VTAC, ventricular tachycardia. But since this client is hemodynamically stable, which means that they're awake, they still probably have a pulse, we want to go from least invasive to most invasive. And so least invasive would be vagaline or giving medication. So in this case, amiodarone, which is an antiarrhythmic medication that can be given IV as well as it can be given orally. But in this case, it's an emergency. So we would start with the IV amiodarone, and hopefully that will help reset the heart to give the correct electrical current. So that is why option 1 is correct, because you want to do the least invasive to most invasive, especially since the client is still hemodynamically stable. Option 2 would be our second option that we would do if the client was not hemodynamically stable. Defibrillation is given for clients that have VFib or who have pulseless VTAC, which means they are not stable. That is the reason why option 2 would be the next one, because probably very soon after this, they're not going to be stable very much longer. Option 3, continue to monitor the client. This is a medical emergency. We want to do more than just monitor the client. At the 11 o'clock live, someone also said a very good point. You never just want to monitor the client. It's very, very, very rare that that would be an answer choice on the NCLEX to just monitor the client. We always want to save lives. There's always something that you could do, best practice, you can assess a little bit more. Never just leave and continue to monitor the client. And then option 4, request a prescription for digoxin. This can actually cause VTAC. It's called digoxin toxicity. If you give a little too much digoxin all at once, or if your kidneys aren't perfusing the digoxin out, this can send your heart into VTAC. So you guys did pretty good on that one. Good job. Next question. The nurse is caring for a client with chronic kidney disease. The nurse notes tall peak T waves on the continuous cardiac monitor. Which of the following actions should or would be a priority for the nurse to take? Option 1, administer IV calcium gluconate to the client. Option 2, teach the client to limit dietary intake of potassium. Option 3, request a prescription for oral sodium polystyrene sulfonate for the client. And option 4, prepare the client for placement of a temporary catheter for hemodialysis. Let me know what you guys think would be the answer for this one. Again, priority. Priority. Which one would you do first? So this priority questions can be all tricky because you might see that there's more than one right answer, which is true, but which one would you do first? If you could only do one thing before you leave the room that could potentially save the client's life, what would be that one quick saving method or intervention that you would do? Let me know what you guys think. So, and then the chat says, what does amiodarone do? Amiodarone is an antiarrhythmic medication that is given to clients that have history or are in rhythms that are not normal, not sinus rhythm. So it can be given to kind of keep their heart in the same rhythm or given IV to reset that heart rate. Good job. Lots of good answer choices on this one. This one seems to not be tricking you. Priority, priority, priority. So the priority for this client would be to administer IV calcium gluconate to the client. Okay, so the tall peak T waves. I saw a lot of people in the chat saying what tall peak waves are, and that is correct. It is giving hyperkalemia, which happens if you have too much potassium in your system for whatever reason. Sometimes certain medication side effects makes you hold on to potassium. Sometimes if you just take potassium supplements, that spikes up your potassium. But people with chronic kidney disease, it's hard for them to metabolize and excrete all their electrolytes. So their electrolytes change very, very quickly and easily. So it is not uncommon to see as hyperkalemia in chronic kidney disease. But if it starts sending their heart rhythm or their EKGs to have peak T waves, this could quickly turn into a medical emergency. So we need to correct their potassium level, bring that potassium level down so it will correct their heart rate and not spiral them into an into a rhythm that is not safe. So the IV calcium gluconate that helps go into the cells to help draw that potassium back out so it can be excreted. So this works against the potassium to bring that potassium level down. The reason why we want to give it IV is because it's pretty emergent. It helps bring that potassium level down. Option 3, again, would be another good option, but since it's given orally, that takes a little bit longer to get into the cells, get into the system to help dry that potassium level out. It's something that we can give afterwards, but it wouldn't be our priority to give. And option 2, again, that would also be a good, correct teaching, but it wouldn't be our priority. Since they already are having problems controlling their potassium levels, we would want to teach them to lower their potassium levels with the things that they eat. And then option 4, prepare the client for placement of temporary catheter for hemodialysis. This is a intervention that happens with people who go from chronic kidney disease to end-stage renal and aren't able to have their kidneys work for themselves. So that hemodialysis catheter would be helpful to filter out all those electrolytes and waste for them. But you guys did great on that one. Good job. Next question. The nurse is assessing a client who has a chest tube attached to a closed chest drainage system. Which of the following findings would be a priority to follow up? Option 1, serous drainage in the collection chamber. Option 2, crepitus around the insertion site. Option 3, intermittent bubbling in the water seal chamber. And option 4, clamp drainage tubing? Again, another priority question. So if you can only do one thing before leaving the room and assessing the client, or as you're assessing the client, which one do you report to the doctor and say that this might change their life if we don't intervene? Let us know, let us know, let us know. Lots of good answer choices. Y'all are doing amazing today. Good job. Make sure to also log on to uworldnursing.com. We have a lot of great resources that you can sign up for. That question of the week that has been very popular lately, where we send you a question directly to your email address so you can practice a daily thing, or not daily thing, a weekly thing, a personalized question to you, and you can try to test yourself instead of waiting for us every Tuesday, Wednesday, and Thursday. Y'all seem to have got this one easy peasy, so I'm going to go ahead and move on. Clamp drainage tubing. Yes, yes, yes. Anytime we have a chest tube or a closed chest drainage system, if it is clamped, that is going to send off alerts to everyone, like, why is this clamped? Unless the provider says to have it clamped for whatever reason, that is the only exception. But any clamp drainage tubing is defeating the whole purpose of why it's even there. So we want that negative pressure to help bring out all the fluid or the air that is in that pleural space or pleural cavity to kind of help reinforce and inflate the lung. So if it's clamped, it's not doing its job. It can cause an even bigger problem like a pneumothorax, and we don't want that. All the other options are probably expected findings, things that we would want to continue to monitor in case something goes bad too quickly, like serous drainage in the collection chamber. This is going to be expected. But if it's too much, too soon, too quickly, then that is something that we would want to look into further. But at this point, it's just simple serous drainage in the collection chamber. I think we're okay. Same with crepitus around the insertion site. That is an expected finding. It's a foreign object into the chest, so you would see it around the insertion site. Once it starts going up into your neck and across the chest, that's when we would want to be more concerned. Intermittent bubbling in the water seal chamber, again, a slightly expected finding because this has to do with your breathing and seeing your lungs expand. That is the waveform or the bubbling that we're seeing in the chamber. So anytime you see a clamped drainage tubing, you're always wondering why. But you guys did great. This is a little illustration of how the different chambers of a closed chest drainage system. You have the chamber for blood, you have the chamber for the water seal where you would see the tidling or the bubbling as the client takes a breath. And then you could also hook it up to suction to create that extra negative pressure to help really bring out that fluid or the drainage or the air from the site. But you guys seem to not even need this little graphic because y'all did so great. Next question. The nurse and unlicensed assisted personnel are caring for assigned clients. Which of the following activities would be appropriate for their nurse to assign to the UAP? So now we're getting into roles and delegation. So you got to know your scopes of practice for RN, LVN, and UAP, which is like a tech on the floor. Option 1, assist a client to the bathroom for the first time following surgery. Option 2, feed a client with dementia who has a serum glucose level of 70. Option 3, explain why incentive spirometer use is important to a client with post-operative pneumonia. And option 4, take vital signs every 15 minutes on a client who was just transferred from the post-anesthesia recovery unit. Let me know what you guys think in the chat. Let me know, let me know, let me know. Y'all are quick with this one too. Lots of correct answer choices. Let me know what other topics that you guys think is hard. Like the next time we do a most missed question. Seems like y'all got roles and delegation right. Y'all are giving good answer choices for this question. But what other topics do you find hard that you would like us to go over more? Maybe you're going into this class this semester and would like a little extra question drill. Let me know. Maternal newborn, yes. We have a lot of maternal newborn OB type questions. Those ones I'm going to push off to Samantha. She's great at that. I am a PCU and IMC type nurse. I like cardiac. So those are where I thrive. OB and peds, I'll get Samantha to do that for y'all. Lots of maternity. Psych. Psych is a one that we actually don't really go over that much. So that is something that we should definitely incorporate more. Pharmacology. Pharmacology is usually our top requested. Lots of there's just so many medications that we have to memorize and understand and know. Oh, some people are saying more EKG or ECG review. That would be great. And psych. More psych. Psych, psych, psych. Correct answer for this one is option 2, feed a client with dementia who has a serum glucose level of 70. So UAP. UAPs, they are like the care technicians. They're like the nurse assistants on the floor. They usually do the things that are ADLs for the clients. So taking them a bath, helping them brush their teeth and get ready and dress for the day. But they usually only do this, not usually, they only do this for stable clients. They don't want to make the client situation any worse. So the easiest way to go about this question is to figure out which client is the most stable, and that would be the safest for the UAP to take care of, which would be feeding the client with dementia who has a serum glucose of 70. Feeding is a part of the ADLs. The dementia is something that they're going to be living chronically or for a long time with, so it's not going to be acute change very quick. And the serum glucose level of 70, this is still considered normal. So this is the most stable client out of all 3 of these, or all 4 of these clients. So that would be the safest one for the UAP to take care of. Option 1, assist a client to the bathroom for the first time following a surgery. This is something that we wouldn't want the UAP to do because it is the first time after surgery. So the nurse should be in there assisting for any first of anything, first education, first intervention, first assessment. The nurse should be the first one, just in case there are complications. That nurse can get in there real quick and start doing interventions and taking care of that client. So for the first time following a surgery, we want the nurse to be there to make sure that there's no complications. Option 3, explain why incentive spirometer use is important to a client. Education, again, is something that is left for the RN to do. Initiating education is definitely for the RN. LVNs can help reiterate and re-educate, but the RN is something that they are the ones that giving that first initial education. And then take vital signs every 15 minutes on a client who was just transferred. That just transferred portion is the main point there. This means that this client is probably still not stable enough yet. And 15 minutes is pretty frequent. So again, that nurse needs to be that eye to make sure there's no complications, especially right out from the from the PACU. So they are going to be the first for everything. But if the client is stable, then the UAP can take care of them. You guys did good. This is a cute little graphic that we have that kind of breaks down the difference between RN, LPN, and the UAP. Like I said, UAP does a lot of the activities of daily living, the ADLs, hygiene, linen change, documenting intake and output, positioning, all the things that don't require true interventions. And the RN is usually doing that initial and first thing. The other main thing difference between RN and LPN and LVN is that initiating that blood transfusion. I think it was last week we did a hematology question drill. And a lot of people were asking, why couldn't the LPN be signing off on blood transfusion? Because this is an RN scope of practice. RN and RN do the blood transfusion. So that is the correct answer. Screenshot if you would like. You guys did great. I think my numbering on my questions were off because this is the last question of the day. So you guys let me know how well you did out of 7 questions. I think I did 7 questions. Did we get 7 out of 7? Did we get 6 out of 7? It is okay if you didn't do well. I didn't do well on some of those questions, the OB questions, but we're all here to learn together and get better each week. And I hope you tune in next week because we have a lot of fun things planned next week. And I think that's it. I hope you guys have a happy Valentine's Day. Have a good weekend.